3 cases in Colorado isn't much in the grand scheme of things, and a vast majority of kids with multi-system inflammatory syndrome, or MISC, recover well, even if hospitalized, according to 9 Health expert Dr. Pyle Coley.
Unfortunately, there have been a handful of children that have had cardiac arrest or severe complications, and some that have passed away as well. But it continues to be a rare disorder.
But Colorado is now among a couple dozen states with suspected cases. New York has 147, and sadly, 3 children have died there. One of the most severe complications is organ failure.
So complications from any of these organs failing could be an immediate cause of death. So whether that's your heart stopping or your kidney function declining, that it can't regulate your electrolytes.
Symptoms include a high fever, high degree of inflammation, and gastrointestinal issues. Red eyes, red lips, and rash are common too in kids 5 to 15 years old. Dr. Samuel Dominguez is an infectious disease specialist at Children's Hospital Colorado. He spoke at the governor's update on Wednesday.
These patients also present with low blood pressures and inflammation of the heart muscle. Of note, the majority of these patients do not present with respiratory symptoms.
While these kids have already had COVID-19, the syndrome doesn't typically affect breathing.
When you have an autoimmune condition after a virus, the body gets confused and actually thinks it might be seeing the virus again and starts launching an immune attack.
And that's what's putting kids in hospitals. Children's Hospital Colorado, which specializes in treating the very similar Kawasaki disease, says doctors and parents should be on the lookout for symptoms,
as both likely benefit from earlier recognition and treatment.
In Denver, Ryan Harrer, 9 News.
3 cases in Colorado are potential cases. They're going to be reviewed by medical professionals this week. During the governor's update today, Dr. Dominguez stressed that he believes that hospitals are a safe place right now and that parents should not hesitate to bring in a sick kid.